that slide. So we can see that overall country attractiveness index, India is the second most preferred destination. And India was intentional in developing themselves to come to that status. So the first step, India improved its attractiveness index. And developing this clinical trial unit is one of the ways that we have identified can quickly improve the attractiveness index of our region. So SATC knows how and will replicate the same for Africa. So the second slide. This actually shows us that the clinical trial improved India's economy. It improved it, but this estimated clinical trial research in the country would be $1 billion to 800,000 euros industry by 2010, whereas another view indicates that 1.5 to 2 billion by 2010, and we're already in 2019. So the Indian clinical trial industry improved its rise of the volume that comes in, and it gained monetarily from 300 million to almost being the second engaging itself in this process. So clinical trial presents economic empowerment for Africa. Now, India's clinical trial industry leapfrog and continues to do so. We can similarly do so by building this infrastructure that I want to propose to the Medical Women Association. So the growth was high, and you can see that it's a leapfrog. So the next one, the same slide, another slide, from $30 million industry in 2004 for India to now a $1.5 billion industry in 2016. You can imagine how that is so. And yet, they are projected to be getting about 5% of the global clinical trials. So, let's look at China. China got itself from 1996, it was on the top 11 on the chart of those who were getting huge clinical trial volume. By 2017, it had topped to the second. And some of these strategies we are trying to put in place are what they did. So you see, let's look at the last graph. You see that we are comparing Africa to her peers. And if you look critically, you see that South Africa is actually the only one, and then Nigeria, you see the volume, the clinical trial of volume is at the lowest level. And if you look at researchers per million people, you find also that Nigeria is set to the last. Researchers per million. So we need to build the capacity as researchers in this enterprise. And then the R&D expenditure, of course, is very low. The market size volume that we are getting is very low. So the landscape is changing, and clinical trials starting now are becoming more and more global with increased activities in new emerging economies. It was included as one of the emerging economies. In fact, we called it the M11 nations, and Nigeria was one. A truly global company that is sponsor company is the one that uses the internet and resources of every corner of the world. So globalization has shrunk the world and enlarged the R&D process of multinational dimension. Next one. So there are different Pan-African efforts that are being made. There's one that's called the Pan-African Private Sector Trade and Investment Committee, bringing all entrepreneurs in Africa together to think and talk with one voice and to work towards achieving a trade-free zone, the implementation of the African Continental Free Trade Area. And one of us in Nigeria, Pat Utomi, has been made the president of this effort. So this is possible. There are other models. There is LT, which is the African Organization for Research and Training in Cancer. There is the History Africa that is together bringing African researchers together to do studies both in cardiovascular diabetes and kidney. And then there's a new one that is coming in that is called the IFEOMA model. All these are to bring synergy to what we are doing in the African region. So the model of ACCC is to be that kind of an African private sector, that kind of model that will be able to bring to the table all hands on deck, working towards achieving higher volumes of clinical trials. And the umbrella of Medical Women Association to co-create at this time of development of this process, ACTC, to form part of the strong hubs that will comprise the scopes in this way of progress. Now, from one to the particulars of ACTC opportunities and brainstorm to come up with strategic frameworks to disrupt prevailing negative paradigms and revolutionize the CT sector in Africa with a one-centric strategic plan and business model that can take us to the peaks of performance in the enterprise. Our incoming president, Dr. Minyo Sechi, has dreamt for many years. So, now to the nitty-gritty. What should we do? What are we expecting to happen? One of the things that has already started happening is that for 6 days before the second clinical trial coming in Cape Town, we trained researchers from different African countries for 6 days. And Dr. Kumozi, president of Medical Women Association of Ebonyi State, is she here? She was beneficiary. And we can bring this training here and have medical women undergo this same training. So the clinical trial will be trainings that are going to be done to build that infrastructure that is needed. You know, when we talk about infrastructure, people think about funding. The infrastructure for clinical trial is mainly human capital infrastructure. That is the main key of infrastructure that is needed for clinical trials. We are going to be training on the clinical trial process, the good clinical practice, the health research ethics committee training, that the HREC training, and creation of HRECs. It's not every institution that now has an institutional review board. To have human subject protection trainings of systematic review, because that is able to give you the real gaps that exist in the system and be able to use that information to write grants that will be able to polish such gaps that will have been detected. Without it, you cannot prove that there is that gap. Creating disease protocols and registries. We do know that in our different hospitals we see thousands of patients. However, if we want to do retrieval of information, the storage, the way we have studied and the way we have acquired the information is not in retrievable form. So we will begin now to create an ability for you to have disease protocols and registries that will enable you to harness your data and do better data management and storage. Then we'll do grant writing trainings, regular online webinars. You can see one that I displayed on the site in the flyer. This series of webinars took place last year. Before the end of this meeting, I will also show us some of the ones that are already lined up for this year, the rest of this year. Mentorship to create a CTU that are PCP compliant, oversight of CTUs and quality assurance, mentorship to have good laboratory practice laboratories. So you need to have that because you need to be accredited to be able to, conduct the test that will be acceptable on the global level. Then recommendation to partners and industry. So you won't just be created and left alone, but you will be recommended to be utilized. Now, as a model, we don't need to start immediately to create a clinical trial unit in our institution. What we need to do is to create a team, to build a team. Now, because in our hospitals, we have multidisciplinary teams. We have nurses, we have medical labs, we have pharmacists, and we have certain infrastructure that we can put together and create a team of personnel as well as infrastructural equipment and facilities that you can present as that belonging to your site. And so when what we call the site readiness information will be able to teach you how to create site readiness, infrastructure, so that when people come for the site visit, they're able to see all you have available and to be able to rate